Hello and welcome to our webinar, Campaigning for Endometriosis Change and How You Can Get Involved. My name is Sophie and I'm the volunteer coordinator here at Endometriosis UK. We are joined tonight by our guest speakers Faye Farthing and Joe Campion, who will be introducing themselves in just a moment. Before I hand over, I would like to remind everyone that this webinar will have a Q&A section towards the end, where both Faye and Joe will be answering live and pre-submitted questions. So without further ado, I will pass over on to Joe and Faye.
Hi, good evening, everyone. Thank you so much for joining us. So my name's Faye Farthing. I am Head of Campaigning and Communications here at Endometriosis UK. I've worked in campaigning for 12 years now in the non-for-profit and campaign sector, and I have been with Endometriosis UK for 6 years working on communications and campaigns. And this is my colleague Joe.
Hi, everybody. I'm Joe Campion, and I've worked with Endometriosis UK for the last year, giving them public affairs advice. And I have previously worked with lots of disability children and health charities doing campaigning and public affairs work.
Thanks, Joe. So this evening, we are going to talk you through what campaigning means, how you can get involved, some of our campaign successes that we've had at Endometriosis UK, and what campaigning looks like for us over the next year and what some of our priorities are. And as Sophie said, we'll take questions at the end. So if you do have any questions, please do put them in the chat. So just to start off in terms of what campaigning actually is. So at Endometriosis UK, we believe that campaigning is really fundamental to everything that we do as an organisation. It's where we can really make change for the 1 in 10 women and those assigned female at birth with endometriosis in the UK. And we can't make that change without you. So thank you so much for being here. And hopefully you'll be interested in getting involved in the campaigning work that we do. So we campaign to raise awareness, we campaign to fight for change, and we campaign to improve policies on endometriosis, both locally and nationally. And we cover a variety of policy areas, and they include, but are not exclusive to, healthcare, education, and employment. And we campaign across all 4 nations. So we work across Scotland, Wales, Northern Ireland, and England to make change for the endometriosis community. So in terms of why we actually campaign, so I'm sure everyone on this call is all too familiar with the fact that endometriosis care is simply just not good enough, and we want to fight to change that. So we know from our latest diagnosis survey that we released last year that it currently takes on average nearly 9 years to get a diagnosis of endometriosis, and that can have a severe impact on all aspects of someone's life, and that's not good enough. And that's part of the reason why we campaign for change. We also know that once a diagnosis is received, there can still be challenges in accessing treatment, and there is no cure. So we need to campaign to change that so everyone has access to the right care at the right time. And all in all, we want every politician to know about endometriosis, the symptoms and the impacts that it can have on every aspect of someone's life. So as I mentioned earlier, we work across all 4 nations, and we want every politician in every nation to know what endometriosis is and to feel empowered to make change for the community that we represent here at Endometriosis UK.
So I'm going to talk a little bit now about how Endometriosis UK campaigns and how we go about making those changes. So firstly, we raise awareness with key decision makers across all of the 4 nations. So that might be MPs, members of the Scottish Parliament, members of the Senate, or members of the Northern Ireland Assembly. So we do this by generally raising awareness about endometriosis. We know that the general public, and this includes all of those politicians, don't know about endometriosis. So we need to start by raising awareness and telling them that the condition exists. And we do this in a number of ways. We respond to consultations saying what we think needs to change. These can be government consultations from maybe the Department for Health and Social Care or from the Department for Education. It can be from health bodies like the National Institute for Care and Excellence in NICE. Or it could be bodies that work with health professionals, like the Royal College of Obstetricians and Gynecologists. So we respond to those consultations when they ask questions about things that they want to change, maybe about new treatments that they want to introduce, and we tell them what we think. And we consult our medical advisory panel if it's a particularly medical consultation. And we speak to our supporters and people with endometriosis in order to find out what their views are on those things too. We build relationships with civil servants and with politicians. We know there are women's health departments, women's health teams, and we need to speak to them, and we make connections with them, find out what they're working on, and give our evidence and what needs to change, and say and tell them what they need to do to make a difference. We sit on various committees and groups, and we'll talk about some of those later. And this is to make sure that endometriosis is represented, and that those with endometriosis have a voice and a way to raise their concerns and issues. And we work with supporters like yourself so that you can call for change directly on matters locally, but also on matters like nationally. And then we having built those relationships, we ask them to ask questions in Parliament or in the Welsh Assembly. We encourage debates. And then we brief our supporters on things that they might like to raise or say during those debates. We call for changes to the law if we think that they're needed. And we hold events. Quite often we've got things like Endometriosis Action Month, and we're holding events in all 4 nations, inviting politicians to come along and find out more, and we can tell them what needs to change. So our current priority campaign areas are, you've probably seen some of the work that we've been doing on this, but we have been calling for a long time now for the reductions to that diagnosis time, which is, as Faye says, is just far too long and needs to change. There are also extremely long gynecology waiting times to get appointments. So we're working, we're raising that with the Department for Health and Social Care and trying to get investment to bring down those gynecology waiting times. We are working on trying to secure access to effective management and new treatment options. And we do that often, as I've said, with NICE and trying to get them to improve their care pathways. And we're doing some work on the Employment Rights Bill at the moment in Westminster to try and influence that as it's going through. This is a bill this is a new law that would be looking to improve the rights of employees, and we think more can be done to make sure that those with endometriosis benefit from those changes too. And then we are campaigning on education, because awareness of endometriosis is still too low. And we believe that this starts right when children are young. They need to be given a good menstrual health education so that they know what is and what is not right as far as menstrual health education is concerned. And then finally, we need to drive education and awareness. Only 54% of people have heard of endometriosis, so that needs to change, both in the general public, but also with the people that are making those important decisions around how the system works, how the healthcare system works, what employers have to do, and what children are taught at school.
Thanks, Jo. And just to add as well around that education drive, it's absolutely vital that every healthcare practitioner understands the signs and symptoms of endometriosis as well. So it's education in schools, but also education of all healthcare practitioners as well. So how we can campaign as an organisation to make sure that healthcare practitioners are recognising those signs and symptoms of endometriosis as well, to help drive down diagnosis time and make sure that when people are attending GP appointments that they are referred onto the right pathway. I thought I'd talk a little bit as well around some of the campaign successes that we've had at Endometriosis UK, and just to say that no success of a campaign is ever done in silo, and it's always thanks to our community that we are able to have this success. So it's by no means raising these and taking the credit. It's a huge team effort to get campaign success. So one of our biggest successes as an organisation was successfully campaigning for the introduction of menstrual wellbeing education in schools. That started on social media. So that started with the hashtag "What I Wish I'd Learned," and we had thousands of people affected by endometriosis sharing what they wished they'd learned in schools. People were tagging their MPs and their elected representatives as part of that, and that was such a powerful social media campaign as well as political campaign, with people sharing their personal experiences and really empowering other people to get on board with that campaign as well. There was also a petition launched as part of that campaign as well, by one of our trustees at the time, Alice, who was also our young trustee and a young campaigner whose education was hugely affected by her endometriosis. So just goes to show what can feel like quite a small thing that you're doing, like signing a petition or sharing something on social media, can actually lead to political change. We also successfully lobbied for NICE to conduct a partial review of the NICE guideline on endometriosis. That partial review came to a close in November. So NICE reviewed part of the diagnosis section on the NICE guideline. And our next step of that campaign is encouraging NICE to do a full review of those guidelines, because there are still fundamental things missing within it. So great success to get a partial review, but good campaigns never end, and there's always something next. So we'd like to see a full review of that. So please do keep your eyes peeled for how you can get involved in that campaign as it moves forwards. We also campaigned for the introduction of women's health plans in Scotland, Wales and England, alongside several other organisations. And again, that campaign continues to ensure that those commitments are actually introduced and implemented. Just to say, in Northern Ireland, they don't currently have a women's health plan, but they are currently reviewing an action plan that we are inputting into. And again, we're hosting an event in the Northern Ireland Assembly, where the ministerial team, so the health minister's not able to come, but they are sending representatives along. So again, shows how your campaigning is making a real difference and getting us those important conversations with people that can make that change. And we also campaigned for the RCOG to introduce a pathway for thoracic endometriosis as well. Another way Endometriosis UK is involved in policy work is through cross-party groups. So you might be aware of how cross-party groups, or they're called slightly different things in every nation. So in Westminster, they're called an APPG, Northern Ireland, they're called an APG, and then Scotland and Wales, they're called CPGs, just to be confusing to have different names. So in Westminster, there is an all-party parliamentary group on endometriosis. So Endometriosis UK provides the secretariat to that group. And we also provide secretariat in Scotland to the cross-party group on women's health as well. So for those of you that aren't aware how these cross-party groups work, so they're essentially interest groups of an interested group of MPs or devolved equivalents who are interested in a particular subject. And that can range from anything from endometriosis, women's health, beer and pubs, golf. I think there was one before the election. Just a very broad range of subjects. But obviously the ones that we're interested in are endometriosis and women's health. They can't make policy changes, but they can raise awareness of issues affecting those with endometriosis and call for change. So although they can't implement change, they can call on ministers and relevant departments to introduce changes. We were involved in 2020 with the all-party parliamentary group on an inquiry into endometriosis, which included a survey of 10,000 people, and on the back of that we released a report in collaboration with the APPG, and that included a series of recommendations. It got some incredible media coverage, and a lot of positive coverage in Parliament as well. A lot of MPs on the back of that really wanted to get involved in endometriosis and raise awareness of the many challenges that were explored throughout the report. So it was a real powerful tool for us in terms of sharing real life evidence of why government should take action, and a huge response from the endometriosis community for that report.
So how can you join us with our campaigning work and make that difference that we're all looking to see? Well, you can joining our campaigns can be really simple. We produce really simple things like petitions that you can sign, or template emails, which should hopefully only take a few minutes to complete. And it will pull up your information of your local MP or your MSP, or whoever it may be. We may set up campaign actions that involve your local ICB, so that you can raise concerns in your area about the health service that you're receiving. Then these sort of actions might invite your parliamentary representatives to come to an event that we're holding in Parliament, or it may be answering some questions in a survey so that we can raise those concerns in a consultation, or asking your MP to meet with you, or sharing your story with your MP. So we try to keep a variety of different actions, and we try to keep you regularly involved with the different things that we think will make a difference or have the opportunity to make a difference. So in terms of campaigning with us, my first request of everybody attending would be to try and take one of our actions. And when you're doing that, if you're taking an action, you can click the button to say that you would like to hear more. And then we can make sure that whenever we're doing new actions, you're alerted that we're doing a new action, and you can get involved. We try to make it super simple. Always welcome feedback. So if there's anything that we can do to change, or in new campaign actions, then do email us at campaigns, and we can try and make those changes. But there should be things that you can get involved with regularly, and taking short, simple actions. We can let you know when key changes are being made, if there's a big debate, and whether we want to get you to email your MP and tell them to come along and speak up. Whatever you do, you'll be joining our movement, and that demands change from governments across the UK, and we always try and tailor the actions so we can get everybody involved in things that are relevant and happening in their area. So yeah, big encouragement to take our campaign actions. Please do. They really do make a difference. And one thing I've noticed since joining Endometriosis UK is how passionate the community are, and how, compared with other places that I have worked, how eager supporters are to tailor the actions and put in a bit of personal information about their experience. And that really does make a bit difference. I'll talk a little bit more about that in a minute, about writing to your MP and the top tips for how to get them engaged. But yeah, it's clear that everybody has, from the Endometriosis UK, has a lot from the endometriosis community has a lot to say. And your passion and your stories can and really do make a difference. And so in terms of getting involved locally, every GP practice should also have a patient participation group made up of patients, carers, and members of staff. So these meet on a regular basis to discuss services and how they can be improved. So another way you can get involved in campaigning is actually to try and influence your services locally by joining your patient participation group and try and improve endometriosis care that way. You could suggest that they have leaflets in their practice about endometriosis, or ask them how they are implementing the NICE guidelines. You could also consider joining your local health and wellbeing board if you're in England, and there are equivalents across the UK that you can get involved in terms of patient improvement. Health Watch also have a number of ways to get involved. In terms of health services, the health reform has been happening over the last few years, and there are lots of new structures within health that you can get involved with, but these are rapidly changing or changing slowly over time. So if you are particularly interested in trying to influence health changes locally, then do get in touch with us and we can make suggestions about things that you can do to get involved in your area.
Thanks, Jo. And I think as well, it's always worth looking at what's going on locally as well, any local events that you might be able to input into. The government at the moment in Westminster are currently doing a 10-year plan for the NHS. And there've been quite a few local events. So they've been doing, I can't remember the name of them, Jo.
The change NHS events that they've been holding across the country, but I think those are slowly coming to an end, but I think there are still a few taking place across the country, so yeah, you could try and get involved in those as well.
Yeah, worth having a look and seeing if there are any, and also I imagine there may be other opportunities as well to input into that as well. So do keep an eye out for any local events and where you can raise questions about endometriosis or any ideas that you might have. And if you want to run any of those ideas by the team here, please do get in touch with us if you'd like any guidance, if you are going to anything locally. Another thing locally that happens ahead of elections are election hustings in person as well. So if local elections, so that could be council elections or general elections, do look out for those as well. And if you feel confident going and raising a question about endometriosis and what they'll do to improve endometriosis care in their local area, we can help you form any questions for those as well. So in terms of writing to your elected representatives, these are just some of our top tips for this. Jo, please do
yes,
chip in on this one as well. It's always best to keep it short, personal, and local. As many kind of local stats, local issues that you can raise are kind of the best things you can do in these emails. MPs represent you nationally, but also locally in your constituency as well. And one thing your MP can do on your behalf is write to a local hospital, like write to local ICBs, etc. So if there is an issue locally that you want to raise with your representative, it's always worth doing that. In terms of sorry, Jo, go on.
If I can just cut in fate, it's worth saying at this point that particularly with MPs, but also with the constituent representatives in the other in the devolved nations, there's a rule that you can only respond to queries from your own constituents. So it's really important when you do make contact with them, and we do this in our template emails, but if you're writing your own, to make clear that you are a constituent of that area, because you're more likely to get a response. I would also say that whilst we would strongly recommend making it personal, so telling a little bit about your story if you're comfortable, but also sort of tailoring it if we're using something, maybe you want to support something that we're campaigning on and we've done a template, it's not quite right. If you can change it just a little bit into your own words or personalize it in some way, even if you're not directly affected by the issue, but can talk about it from the perspective of your area or yourself, then that always really does help. And the but is, I would encourage you to keep it short as well. And a lot of, whilst I'm sure that many of you have many years of experience that you'd like to share, and all these elected representatives are very short of time. So if you can try and keep your stories as succinct as possible, then it will mean more chance of it getting read. And yes, so I think that would be my tips for if you're writing to your elected representatives. But yeah, and then Faye, you can move on if you want to share your stories.
Thanks, Jo. And then in terms of sharing your stories, I think I'd like to add here as well that, like, never underestimate how powerful your story is, and how much your story can empower a politician to want to make change. Because every time I speak to a politician, they're so often so appalled by the fact that it takes on average nearly 9 years to get a diagnosis, and you know, the absolute devastating impacts that this can have. And when I've had meetings nationally with members of parliament, they've often come to us and asked for a meeting because one of you has written to them sharing their story. So it is a real nice, like, kind of circle thing of you lobbying your MP, and then MPs often either meeting with you or meeting with us. And the reason for that is often because you have shared your story, and that's had an impact on them, and empowered them to want to make change as well.
Yeah, we often see that after MPs have been contacted by their constituents with particularly powerful stories, you often hear them raising it in debate in Parliament. You often see them tabling questions. It does really often seem to inspire them to do something in response to that. And it's either contact us or put it out there. So I would say that that it sometimes might feel like you're sending these emails and nothing's coming back. And sometimes actually it has prompted some action that you might not always be aware of.
Yeah, definitely. And it's so incredibly powerful to hear those stories in Parliament when they are shared. So if there's a debate, for instance, in Parliament, so there was a debate fairly recently on endometriosis in the workplace, and, you know, MPs sharing stories of their constituents is such a powerful thing, both for the person who shared their story, but also for government to hear those stories. As well. In terms of sharing your story, so we have a share your story form on the website, and that's not just for kind of us being able to share that across our website and our social media. That's also to help us with our campaign and policy work, so we can see what issues the endometriosis community are facing, and then we can share these stories with elected representatives as well, or in policy consultations, etc. It's always those stories that you know, really do add to any of the policy work that we do and inspire change. So if you'd like to do that, then we can share the links to that. Or if you just go to our website and go to get involved, share your story, and then it's all on there. In terms of actually meeting with your local MP, so MPs hold surgeries in their constituency. They tend to be on a Friday, and you can meet with them to discuss your experience of endometriosis. We've produced a guide that's available on our website on meeting with your MP, so please do have a look through that. And if you do manage to get a meeting with them, please do always keep us posted, and we're always very happy to have a chat with you beforehand, or if it is possible and we are able to come with you, then that's potentially an option as well, if that would be helpful for you as well. Jo, I don't know if you want to add anything around.
Yeah, well, I was just going to say with that, I think sometimes this so it can be useful in campaigning, the MP surgery on a Friday. Not all of them hold it on a Friday, and but they do often in the larger constituencies hold them in different places. So there are two ways. You could email your MP and ask to attend a surgery and find out more about where they're holding them. But you can also just usually look on their website. They will have a local website which will say where they're holding their next surgery, and usually have a form where you can book in. And these surgeries are often used for what they call individual casework. So if there's a particular problem that you're experiencing, maybe a particularly long wait for a procedure or treatment, or you've had an issue with your workplace, or some issue that you want their actual help, helping you with your individual circumstance, they can help you with that, raising it with not just raising it nationally as an issue that needs to be addressed at a more system level change, but actually help you with your individual problem that you're facing locally. Maybe contact your local health service and try and unblock issues for you. But I think the surgery is also a really useful, because MPs get an awful lot of emails, and so they are used to receiving campaign emails on a whole range of topics, as you can imagine. And so sometimes when you write to your MP, you may not receive responses. I know I, for many years, didn't receive one from my previous MP, but for my new MP seems to be responding to me now. But you can go through periods, and certain MPs just have so many emails that they don't respond. So this can be a really useful tool, the surgery, if there's an issue that you're particularly passionate about, or you've got a particularly difficult problem that you need some help with locally, then going along to the surgery can be really good for an MP who doesn't respond particularly well to emails. And you can find that information publicly when they're holding their surgeries, and you can just book in, and then there's no opportunity for them to ignore you because you're right in front of them. So yeah, it can be a really effective tool. I've actually seen ministers make changes to legislation based on the fact that they have been lobbied at their local constituency surgery on an issue that they wanted to seek change. It wasn't in this particular area, but it can be a really powerful way to make change.
Thanks, Jo. And just to say here, I don't know if there are any support group leaders on the webinar as well. But just to say, we have facilitated in the past opportunities for MPs to actually attend support groups. So we'd always let everybody know in advance that was the purpose of the support group meeting for MPs, to hear your personal experiences. And we've also set up local meetings for MPs to attend and hear from their constituents. So if you're interested in setting up a local meeting with other constituents in your area as well, with people with lived experience, and you'd like an MP to attend, then please do get in touch with us and we can help facilitate that as well. So that brings us to the end, unless there's anything that you wanted to add, Jo, on any of that before we move on to questions.
No, I think just it would be great to hear some questions. So.
Brilliant. Well, thank you both so much. I am going to jump between some of the live questions we've had and some of the pre-submitted questions we've had. So if you do have any questions, please do just type them away and we can get Jo and Faye to answer them. So I'm going to start off with one of the pre-submitted questions that we had. And somebody asked, what is, up to this date, the most powerful action someone or potentially a group of people have taken that's contributed to change?
Do you want me to kick that one off?
Yeah.
I think for me, the menstrual wellbeing in schools education campaign was particularly powerful, and that started with a petition, and like I said earlier, it just goes to show that something that can feel quite small can have such a huge difference. And it felt like that campaign had such a huge impact on everybody, and it's an area that will make such a huge difference to everybody's life. If everyone understood the signs and symptoms of menstrual health conditions and what isn't normal, then that could have a huge impact on reducing diagnosis times. So it felt like that was a real step change for endometriosis education.
Yeah, and Sophie, I feel like with the Employment Rights Bill campaign that we've been running, there's been so many people have taken our campaign actions on this and contacted their MPs. So we've had a lot of interest in this topic. And whilst we haven't seen the change and the adoption of menstrual health action plans yet, and I hope we will be able to see that at some point, I have seen lots of MPs raising this, and it's definitely coming from those campaigners and those from the endometriosis community taking those actions, because it's coming from MPs that we haven't had contact with before, who are coming to us and asking for more information about it. And most recently, there was a Women and Equality Select Committee, which is quite an influential committee in the Commons, and they had the Minister for Women's Health before them, and they asked them this very direct question about menstrual health action plans. And I'm pretty sure that that was a result of people taking those campaign actions. So it may only take a couple of minutes, but it does mean that you have that action has put the minister in the hot seat and actually had to answer the question. The change hasn't happened. I see that change takes time. And my advice to all of you as potential campaigners and future campaigners is that persistence is key with this campaigning. Campaigning can be exhausting, and it can be really quite disheartening to be having to saying the same things over and over again to the same people sometimes, and feeling like you're not being listened to and you're not being heard. Change does take place very slowly, and the mechanisms of government are even slower. And so sometimes we just do need to keep saying the same things, and we need to think about ways of making sure that we're energized as campaigners and we can take little breaks, and that we've got a group around us to kind of keep us going, because it can be a bit exhausting. So stay persistent, but take little breaks and come back to it if you're feeling a bit exhausted. But yeah, it really does make a difference, and it does mean that although the ministers that need to make these decisions and take these changes don't necessarily do it straight away. Sometimes the right conversation in the right place, it just happens, and we'll get there in the end.
Brilliant. Thank you, Jo. I'm going to go to one of our live ones just off the back of what you two have both said. Someone's asked, can we make our own petitions for you? Or can we put forward ideas for campaigns or run local campaigns?
Yeah, do you want to take the campaign prioritization one, Faye? Or
yeah, sure. Yeah, I can take that one. So all of our campaigning is based on evidence from the endometriosis community. So that for us is the fundamental thing about our campaigns, is that we want them to be relevant and impactful for the endometriosis community. So if you've got an idea for a campaign, please do get in touch with us. Or if you've got a specific issue locally as well, we have been contacted quite a lot in the past if there's a specific issue in a local area. So just to give an example, we were contacted think around last year around an endometriosis specialist nurse going on leave, and that person not being replaced. So we got involved in a campaign there. So if there are local issues that you want to campaign on, please do get in touch with us, and we can support that where we can.
Yes. And sorry, was there another part of that question? I'm
just looking at if they wanted to create their own petitions to put forward to you. I'm guessing it would tie into what Faye said there, just getting in touch.
Yeah, I think if you're going to start a petition, it's quite, I mean, some of these things can be super organic and they can grow really quickly. Others might take a little bit more time and work. What might be helpful is before starting a petition is getting in touch with us and maybe running some of the wording past us, so that we can kind of give you some tips and advice on how to make sure that it's broad, it's relevant, and then it can gather as many signatures as possible, and then we can support on helping get those signatures. Sometimes I see wording that's been really, really specific, and then it makes it difficult for everybody to get on board with for whatever reason. But yeah, there are ways you can set up petitions yourself on like change.org. But there are also government websites where you can do the government petition and try and get change that way. But I would suggest getting in touch with us and asking our advice on the wording before setting up your own, because then it can we can hopefully get some wording that can attract more people to sign it.
Brilliant. That's so interesting as well, just the way you phrase things and
Mm.
speak about things and how you can get people involved. I'm going to jump back to one of our pre-submitted questions here. Someone's just flagged that they have quite significant severe endometriosis and are just asking how they can get involved in campaigning for change when they might need to be a little bit more flexible with how they do it. I know you mentioned some of the e-actions and things like that, but would that be the best avenue for them?
Yeah, I mean, absolutely. The great thing about campaigning is that you can kind of dip in and out of it. If you join, take one of our actions would be my advice, because that only takes a few minutes. And then you can click on to stay in contact, and then we can let you know when we're taking new ones. And most of the time we will try and let you know. If it's a survey that's going to take 15 minutes to complete, then we'll let you know how long it's going to take. If it's going to just be a couple of minutes, or it's signing your petition. But if you want to run a campaign locally, I'm not going to lie, it's if you're going to set up and run and lead your own one locally, that's going to require a certain amount of commitment. So I wouldn't advise doing that on your own. If you are not going to be able to guarantee the commitment to it throughout. But if you have a support group in your area and can get them interested in working together to campaign on that issue locally, I would suggest then you can share the load, and different people can do different aspects of the campaign and keep it going when you maybe need to take a break or a step back.
Brilliant, thank you. Someone's asked about sort of statistics and finding out information from their local area. So they've asked, how can you find out statistics from your area, sort of around waiting list numbers or procedures that have been happening, or how long people will be on the waiting list for before procedures?
Mm-hmm.
Do you want me? Oh, sorry, Joe. Do you want
Yeah,
to
no,
go?
you take it, Faye. But yeah, I mean, there is the ARCOG one, but which I'm sure that, around the waiting lists, but there is a lack of data collated in this way, and I'd love this too. Is basically all I want to say.
Yeah, exactly. And that's one of the biggest issues for us as a campaigning organisation, is having that evidence. There's a real lack of evidence, and there's a real issue, especially with endometriosis care, in terms of coding. So the way that it's actually coded in the back end of the NHS system is not particularly helpful for us in terms of tracking endometriosis statistics locally. The RCOG have a waiting times report that's got some really good statistics in it, and they've got like an online system where you can type in your postcode, and it tells you how many people are on a waiting list in that area. So there are ways to get some levels of data, but data is an area that we often campaign on in terms of the policy consultations that we respond to. It's often one of the policy recommendations that we make in terms of improving data around endometriosis care, because that would hugely help us to lobby MPs to make a difference.
Brilliant, thank you. I've got someone here asking about the APPG report you did in 2020, and basically just asking, will you be doing something like that again, or campaigning to do something like that again?
Possibly. I think it's fair to say that unfortunately not a lot has changed since that 2020 report. So there's a lot of evidence in there that is still very relevant. So in terms of doing a report, it's really important that you do it at a time and on an issue where there isn't much data, to kind of gather data that you don't have. So I do think that report, although it was in 2020, is still very relevant in terms of the lobbying work that we are doing. In terms of who sets the agenda for those APPGs, so it's the MPs themselves. So it's not Endometriosis UK. We don't have control over what those MPs who are on that group want to do. So it's up to them essentially what they look to do. But I would say I do think that report is still, sadly, very relevant. Joe, I don't know if you've got anything to add
Yeah, well,
on
the
that
only
front.
thing, I mean, completely agree, Faye. I think sadly it is still relevant. So and like you say, it's for the APPG, the MPs on that group to decide what the agenda is. And I don't think they've suggested a report similar to that more recently. There is, the only thing I would add would be that there is the Women Inequality Select Committee that I mentioned earlier did do their own inquiry, not on endometriosis, but on women's health. And it did feature endometriosis frequently throughout the report. And that inquiry actually just concluded at the end of last year, and the government has to respond in detail to those 51 recommendations in that report. So much more up to date than the APPG report is this Women Inequality Select Committee report. And we are actually expecting a response to that from the government around about the 5th of March. So we'll definitely be putting out information on what the government says and what we think what we think about their response around about that time. So do watch out during Endometriosis Action Month as well. So we'll be sharing that news when we get it.
Brilliant, thank you. I've got someone ask here, where do they find out about the patient participant groups? Is it on the website for the GPs or elsewhere? Sorry, Jo.
So it should be on their GP website. It varies, I think, across the country, but assuming that person is in England, I think that would be, it should be on their GP's website. There is actually a patient a participation group organization as well that sort of tells you about them. So you can look at that, and I can't remember exactly what they're called, but there's a sort of representative organization that sort of can signpost you to those as well.
Brilliant, and equally quite similar question. How do we find out about our local endometriosis nurses? I think that's on the back of what Faye was talking about, how they got involved in that local campaign.
Do you want me to take that one?
Yes, please.
Jo. So if you are seen in an endometriosis centre, so a BSGE specialist centre, you should have access to a specialist nurse. We know that that's not the same across the country. So although that is in the NICE guideline that if you are seen at a BSGE centre, one of the kind of stipulations of that is that you should have access to an endometriosis nurse. Unfortunately, due to funding, we know that that isn't always the case. If you go to the BSG website and type in your local area, it does tell you where your local BSG centre is and who the endometriosis nurse is, I believe.
Brilliant, thank you. I've got someone as well asking, where can they find out if they have a local support group that might be interested in getting involved in campaigning?
Sounds like one for you, Sophie.
Does sound like one for me, which I'm happy to answer. So you can find out more about our local support groups on our website. There is a section under support that looks at the support groups we have in the area, so you can look on there. Or equally, if you're not too sure, you can email support@endometriosis-uk.org just to find out more, and we can send you in the right direction there. It's fun. I never get to answer questions on these. That's fun. We've got someone who was just asking off the back of the campaign for raising awareness about education and endometriosis, that it's often thought as a sort of a period-related condition, and a period problem comes to mind there. Is that something that you raise awareness about in your campaigning, that it's more than just a period?
Yeah, definitely. Really great question. And so we have kind of our political campaigns, and then we have our general awareness raising campaigns as well. And that's a real issue. I think there's still such a, I can never say this phrase, societal taboo around endometriosis, and still that myth that it is just a bad period, which we all know that it isn't. So there is a huge kind of step change that society needs to make in accepting that endometriosis can be a severe disease that can have a severe impact on people's lives. So that's definitely a priority for us as an organisation in terms of raising awareness of the impact that it can have on people's lives.
Brilliant, thank you. And then I've got someone here, Carrie, who's sharing not a question, but a sort of a tip. They've shared most health boards host annual reviews where members of the public can ask questions about health services. They did this in November and received a response on wait times and how they were going to resolve this, and surgery techniques and training of surgeons surgeons for her group members. So just quite an interesting tip there, and another way that people can get involved in campaigning on a more local level.
I love that. Yeah, no, I think that's great. I mean, what a great suggestion. And it seems to have actually, the fact that you've got a response locally on that, on wait times, is just shows that going along to these things does often result in, or at least it results in the raising of the awareness, but it hopefully results in a conversation too, and some steps towards change. I think people are sometimes quite hesitant in getting involved in health campaigning in particular. People are obviously, when they're facing a health condition, can feel quite vulnerable, and sort of speaking to their local health services about improvement can be quite challenging. So I think that those sort of open forums where you can go along and raise questions, if you are comfortable, it really can put this issue further up the agenda, and can really be well worth doing. So I think that's a great tip. Thank you very much for sharing.
Brilliant. We've got a question here from Ellie just asking if you have any recommendations about raising endometriosis awareness just in the workplace.
So I mean, Faye, we do obviously have a series of resources for endometriosis friendly, for our endometriosis friendly employment scheme, and I think we've got other resources on our website which this person could potentially have a look at. Is that a good place to signpost them to?
Yeah, definitely. I'd recommend looking at our endometriosis friendly employer scheme. So that's a scheme that employers can sign up to, and Endometriosis UK can provide support to those employers that sign up to the scheme. We also run lunch and learn sessions for organisations, so we can give talks in workplaces as well. So worth speaking to your workplace and seeing if they want to sign up to be an endometriosis friendly employer, or they're interested in a workplace lunch and learn session that we do a lot at the charity as well. And as Jo said, there's a number of resources on our website as well. We have a colleague, Julie, who runs our endometriosis friendly employer scheme. So if you do want to contact her about it, if you go to the employer section of our website, there's an email address there. So please do drop Julie a line, and I'm sure she'd be happy to support you in guiding you to those resources and things.
It's probably worth saying here as well that, I mean, we do know this is an issue that really does cause a lot of concern to the endometriosis community in terms of work, which is one of the reasons why we have been campaigning on the employment rights bill, because we do hear a lot from the community that, yes, there are some really great, flexible employers out there who are really open to making the small changes that might be needed. But there sadly are too many that don't make those changes. And we know that it can be uncomfortable to have those conversations with your employer. So whilst we can't sort of support people with individual issues with their employers, we do have a number of resources available so that you can have those conversations, because we know this is a really big topic. And one that we really would like to see government take action on too, because we feel that the responsibility shouldn't just be on the employee to raise the issues all the time, and that there needs to be stronger protections for employees, and that employers need to take this issue more seriously.
And am I correct in thinking that there's an e-action as well that's live currently that they can write to their MPs with?
There is an action on our website that you can we'll pull up a template email, and that you can email your MP about the employment rights bill, and asking them to show their support for introducing menstrual health action plans, amongst other things.
Amazing, thank you, Jo. And this is our last question here. I can see, which is quite a fun one. Just wondering if you've had or have any support from high-profile celebrities in supporting any of the campaigns you're doing.
I can take that one if that's helpful.
Yeah.
So we have been contacted by a few celebrities interested in getting involved. There are a number of celebrities that have endometriosis that speak very openly about their experience. It's quite a new area for us, to be honest, at Endometriosis UK in terms of working with celebrities. So we don't have anyone kind of on our books, as it were, that we directly work with, but do keep your eyes peeled for Action Month, because we will be working with someone exciting that we can't reveal yet during Action Month. So keep your eyes peeled for that. That's kind of our first experience of working with a celebrity in that way, but definitely an area that we're interested in exploring as we move forward.
Brilliant. And then I think another person's just shared an experience they've had as well. Last week they had a 15-minute phone conversation with their regional MSP secretary regarding sort of medication they're taking, and this secretary was so unbelievably kind and supportive, and that they will be taking this and the 24-year story this person shared with them to the head of the health board in March and potentially raising the issue in Parliament, which is just really fantastic to hear and a really nice note to end on as well, I think.
Yeah, I think, Sophie, that's a great note to end on, and just a reminder that a lot of the MPs, the MSPs, and others that you come across in campaigning, they have come into politics to try and make a difference. And I think sometimes we are a little bit intimidated by those in these positions, but actually I would strongly encourage that not everybody is kind and lovely and nice, but they often have staff that are very used to dealing with people with casework and with people in very difficult circumstances. And so hopefully if you do make approaches, you will be treated kindly and sensitively. But it really does make a difference when they hear those stories direct, because that's the sort of thing that they can raise with those that can make a difference, and hopefully we'll get the change that we need to see. So yeah, well done for being brave and doing it, and yeah, let's encourage everybody else to do the same.
Yeah, amazing. Thank you so much for sharing. And I don't know who asked that, who raised that, and someone else earlier who had some success as well. But we'd love to share that. It's always really empowering for our community if we can share people's success stories of writing to their elected representatives. So if you wouldn't mind emailing us with that and a quote, if you're happy to, for us to share to empower others to do the same, that would be amazing. Thank you for sharing that.
That's brilliant. I just want to say thank you so much to both you, Faye and Joe there, for today's webinar, and to thank you to everyone who joined us today and submitted their questions.